Alex, and he is a 2-year-old toddler, and this is Alex's dad who came to drop him off at Good Start Early Learning Center. Dad brings him to the toddler room, which is a family grouping room in the morning. As he enters the room, he starts to show his anxiety as he clings to Dad very tightly. Sal, the educator in the room, says hello to them and acknowledges his feelings. As Dad walks out the door, center cook Chrissy walks in and forcefully takes Alex and says to him, "Let's go feed the turtle, you're fine." We could still hear him crying in the foyer. After a few moments, Chrissy takes him back to the room and leaves him there crying on the floor. Sal gets frustrated from his crying and shouts at him and tells him, "Find something to play with and stop crying." The yelling and excessive instruction make him even more upset, and now he's kicking his legs and throwing toys everywhere. After he gets up and stands by the door waiting for his dad. Sal once again yells at him to move away from the door so other parents can come in. After watching the scenario, I will analyze the educator's response to Alex's challenging behavior. It is sad to say that both educators did not respond well to Alex's emotional needs. He showed various signals of emotional distress, for instance, clinging to Dad, crying loudly, not wanting to separate from Dad. Acknowledging and responding appropriately to children's signals help children to develop trust and confidence that the adult will be available and supportive. Chrissy demonstrated a lack of interpersonal skills and not being able to read his emotional cues as she took him without acknowledging his emotional state, and she pulled him back as she was unable to settle him down. Understanding and interpreting the social and emotional signals of children is a crucial element of effective teacher-child interactions. This skill depends massively on the personal traits and interpersonal abilities of teachers. When he came back to the room, Sal's response was inappropriate. She dismissed his emotional burst out and offered no assistance or reassurance to calm him down. At this age, toddlers have emotional needs, and when these needs are not met, they feel a range of negative feelings. Sal lets her own feelings take over, and she forgot to listen and validate Alex's feelings. Her anger, frustration, and annoyance are likely to result when she only focuses on herself rather than prioritizing Alex's emotions. The biggest contributing factor in a child's emotional well-being is nurturing a relationship and responsive interaction, which provide consistent support for children. Sal was unresponsive towards Alex's feelings, angry response, and marching multiple orders and invalidating his emotions. Teachers' emotional language sends messages regarding the value of toddlers' emotional expressions by encouraging emotions or dismissing emotional expression. All these inappropriate responses contribute to escalating the severity of his challenging behavior.
As caregivers and educators, understanding the contributing factors behind this behavior is crucial for providing a supportive environment for the children. Next, we will explore the various factors that contribute to toddlers' separation anxiety in the childcare settings. Attachment theory, proposed by John Bowlby, suggests that early childhood relationships is significant in shaping a child's emotional and social development. According to this theory, children at young age form strong emotional bonds with their primary caregivers, usually parents, who serve as secure bases from which they explore the world. When these attachment figures are appearing to be inaccessible, toddlers may experience distress due to their need for comfort and reassurance. The attachment relationships play a significant role in toddlers' response to separation. Securely attached toddlers feel confident in their caregivers' availability and responsiveness, which makes separation more manageable. Conversely, insecurely attached toddlers may show distress during separations and feel uncertain about their caregiver's return. Temperament is the way children respond to the world. It influences the way children handle emotions, regulate behavior, feel around new people, and adapt to new situations. Individual differences in temperament can also contribute to separation anxiety. Toddlers having inhibited temperament tend to be more cautious with unfamiliar situations and people. Thus, separation from primary caregivers become particularly challenging for them. On the other hand, children who demonstrate high level of adaptability are more flexible and are able to adjust to new environments. They may be more resilient in coping with separations. Moreover, the level of sociability can also influence toddlers' response to separation anxiety. Children who are more outgoing may find it easier to engage with the new caregivers and peers in childcare settings, which reduces their distress during separations. Understanding developmental milestones is essential for comprehending separation anxiety. Toddlers undergo rapid cognitive, emotional, and social development, which significantly influences their reactions to changes. When children are around the age of 1, they begin to develop a sense of object permanence. The children start to understand objects and people continue to exist even when they are out of sight. While this cognitive milestone is a crucial achievement, it can also contribute to separation anxiety as they become more aware of separations from familiar caregivers. Moreover, toddlers are still learning to regulate their emotions, which makes separation more challenging. They are still learning to express their feelings verbally, which leads to anxious behavior such as crying, hitting, and kicking. The childcare environment can also impact a child's experience of separation anxiety. Factors such as educators' response, the physical environment, and the presence of familiar objects or routines can affect separation distress. Consistent routines can provide a sense of stability and security for toddlers in childcare settings. Knowing what to expect can help reduce anxiety and make separations more manageable for young children. Children's separation anxiety is a complex phenomenon influenced by a combination of factors, including attachment patterns, temperament, developmental milestones, and environmental factors. By understanding these contributing factors, educators can better understand the communication of the behavior and implement supportive strategies to facilitate a smoother transition into the childcare settings.
Hi everyone, my name is Nataliya, and in the following slides I will be discussing the strategies to assist with Alex's separation anxiety, which are building trusting relationships with families, continuity of care, acknowledging feelings with compassion, and communication and critical reflection. The Early Years Learning Framework acknowledges that families play an essential role in their children's education and are their first and most significant teacher. It is crucial for educators to create a welcoming and culturally safe environment where every child and family is respected, regardless of their background, ethnicity, language, religion, family structure, or gender. Collaboratively, educators, children, and families work together to make curriculum decisions that lead to meaningful learning experiences for the child. It is crucial for educators to build trusting relationships with families to ensure that when parents drop off their child at the center, they can be confident that their child is in safe hands. This trust is especially important when a child like Alex shows signs of separation anxiety, which is normal for young children. In the video, both Alex and his father appear anxious, which suggests that a trusting relationship may not yet exist. Therefore, building trusting relationships with family, exchange information about the child, it is crucial for Alex to build his confidence and sense of security and well-being. In this slide, I'm going to discuss continuity of care as a strategy for dealing with separation anxiety. There are only a few published studies on continuity of care in childcare settings, and the results have been mixed. One study found that children in childcare programs that promote more stable and consistent caregiving relationships have teachers who are more responsive and engaged with the children, according to Ruprecht 2016. The study classified stable caregivers as those who have been at the childcare center for more than 3 months, and not stable caregivers as those who have been there for less than 3 months. The study also found that when distressed, toddlers were more likely to seek comfort from stable caregivers, and that these caregivers were more successful in suiting the toddlers. Even when not in distress, toddlers sought out stable caregivers more often, using them as a secure base. These findings suggest that infants and toddlers enrolled in out-of-home care who experience more changes in non-parental caregivers in the short or long term may be vulnerable to less positive or engaging interaction with their caregivers. Based on these findings, it is hypothesized that toddlers who experience continuity of care in their child care arrangements would experience higher levels of interactive involvement from their child care teachers. It is evident from these studies that young children like Alex need continuity of care to be able to build their attachment security. In the scenario, Alex was taken soon after the drop-off by the chef of the center and then returned to the room by a different educator. As a result, the primary educator wasn't able to support Alex as she was more focused on her own feelings, which I will discuss in the next slide. Ruprecht 2016 proposed that toddlers who experience continuity of care in their childcare settings are more likely to participate in interactive activities with their caregivers. And once again, children feel safe and secure and supported when they build a secure attachment with one and then other family educators. Acknowledging children's feelings with compassion is a vital pedagogical practice when supporting children emotionally and socially. Porter 2016 emphasizes that it is important educators to prioritize children's emotional needs instead of focusing on their own and act with compassion. This will help educators understand what children are trying to communicate about their needs. Responding with compassion to children at young age is important because they don't have an understanding how to deal with their emotions yet. They need guidance, and it is important for educators to have knowledge and to be able to support children's needs and don't express their own feelings instead, as that is only adding up to the anxiety and distress to the child, what child feels. Compassion is considered critical in a social cultural perspective, and it has a significant impact on daily teacher-child interaction. Compassion is, as pedagogical practice is demonstrated through joint conversation and acts aimed at elevating children's distress. Teaching is a moral and compassionate activity, and it is essential for educators to act with compassion when supporting children emotionally. Compassion means listening and responding sensitively, trying different calming strategies such as creating a quiet environment, playing calming and soft music, being understanding, and being there for the young human who needs your support. As mentioned in the early years learning framework, effective communication and reflective practice are crucial components for providing young children with the best start in early childhood education. To achieve this, educators must work together and collaborate to ensure that they are working towards the same goals and implementing the same strategies for managing children's behavior. These strategies are based on communication with families and observations, which are discussed collaboratively in a sensitive and ethical manner. Critical reflection is vital for educators as it enables them to reflect on their own practices and actively seek support to enhance their own development for the benefit of children's well-being and learning. Communications are vital as children's learning development and well-being is improved when educators communicate, work professionally and ethically together, and share ideas and views about improving practice. Thank you.
In summary, this detailed analyzation has shed light on the nature of dealing with separation anxiety in children in an early childhood setting, underscoring the crucial role that teachers play in nurturing their emotional well-being. The case of Alex vividly demonstrates how educators' responses can impact a child's state. As suggested by Arthur et al. 2021 and King and La Parra 2018, they recognize that appropriately addressing children's cues is essential for building trust and emotional security. Unfortunately, the educators in the scenario clearly lacked skills and sensitivity, which worsened Alex's distress instead of easing it. Baoyan's explanation of contributing factors such as patterns, temperament, and development milestones deepens our understanding of separation anxiety, highlighting its nature and how it may be expressed. This knowledge is vital for educators to create a nurturing environment. Nataliya's recommended strategies, including fostering trusting relationships, maintaining continuity of care, and showing compassion towards children's feelings and encouraging communication and reflection, offers a foundation for managing separation anxiety. By integrating principles from the early years learning framework into these strategies, educators emphasize the importance of taking a collaborative approach. Additionally, Nicole's emphasis on the circle of security model underscores the importance of creating a supportive classroom environment. Based on attachment theory, this model suggests that educators should balance protection and encouragement, emphasizing the importance of stability, responsiveness, and fostering independence in children. When combining these viewpoints, it is evident that addressing separation anxiety in toddlers requires a strategy. Educators need to possess the knowledge, skills, and empathy to recognize and address the needs of children. By forming attachments, engaging empathetically, practicing reflection, and creating a supportive environment, educators can effectively reduce the impact of separation anxiety. This approach promotes young students' well-being and establishes a solid groundwork for all their overall growth and achievement in an early childhood education environment. Nataliya suggests strategies for addressing separation anxiety stress, including building relationships with family, maintaining care practices, showing compassion for feelings, and promoting open communication and self-reflection. These strategies align with the circle of security model principles that provide protection and encouragement to explore. Implementing these approaches in the classroom can significantly reduce children's separation anxiety. Consistent schedules, attuned teaching, and a promotion of exploration can contribute to a safe and supportive classroom atmosphere. In summary, teachers and caregivers hold a role in addressing behaviors in young children. By establishing a positive environment within the room, they can assist children like Alex in managing their worries and foster a positive outlook on learning and school experiences. Introducing a relationship building technique in education settings is vital for the emotional and academic growth of little learners dealing with separation anxiety. This scenario emphasizes the importance of development for educators to equip themselves with the skills to support children's emotional well-being effectively. Thank you for listening.